Hello there, welcome to the clinic. I'm your optometrist today. I'm going to carry out a thorough investigation following your referral from your doctor at your recent cranial nerve examination. So I have the referral here in front of me. So there was a concern during ophthalmoscopy, your left eye. The doctor thought there may have been some signs of glaucoma, and that's up to me to have a little look and carry out a detailed examination. Before I can begin the tests, I have to just ask you a few questions just to cover a few bases. So first up, do you drive? Has there been any recent changes in your vision? Any blurriness or mistiness? Any pain to the eyes? Are you experiencing any pain? What about redness? Any ocular redness? Do you ever notice halos around lights? In your lifetime, have you ever been to the eye hospital? Excellent. Do you suffer with migraines? Any cold extremities to the body? Are you diabetic? Have you been diagnosed with hypertension? Any family history of glaucoma? And finally, are you taking any medication? Brilliant, so let's begin with the tests. Okay, I'm going to carry out eye pressure test first, applanation tonometry. So I just have to set up the tonometer. So this device here. We shall place a clean, sterile tonometer probe into the machine there, just like so, and the tonometer gently applanates a small area on the cornea of the eyes. So we're going to start at about 14 mil of mercury. That is set up in place. Checks are looking good. Okay, so because the probe gently touches the front of the eye, it is very sensitive, so we have to numb the cornea with some anaesthetic. This is lidocaine with fluorescein already contained within. So your eyes will be a little bit yellow. The drop just stings very slightly. Looking up to the ceiling, we're going to check both eyes. Drop in the right and a drop in the left. Just give that a moment. While the anaesthetic is getting to work, I'll set up the slit lamp and tonometer. Okay, we want a bright, maximum width blue light there. So check the magnification is correct. Lovely. Okay, let's hit the room lights. Okay, let me bring it closer to the surface of the eye. just align the instrument there. Okay, we want the light source there. Everything is looking good. Okay, now keep looking straight. Breathe normally. Just going to bring it a little bit closer and let's have a look at the reading there. Lovely. A reading of 14 there. Okay, let's set up the left. Keep looking straight. Take a blink. And now stare, please. Okay. So looking at the pressures there, the left is certainly higher than the right. Right 14 mil of mercury. Left was actually 20. So we have a difference there of 6. That's an important finding there. Okay, let's remove the Goldman tonometer. Right. I'm just going to check the front of the eye for any staining since we've touched it. Closer. Okay, for this part, just looking at my left ear, please. The surface of the cornea is clear in the left following applanation. Okay, let's go across a little bit there for the right. Just looking in the direction of my right ear, please. Excellent, so there's no corneal staining following contact with the Goldman. Okay, let's switch to some white light now. Okay, so I'm going to check the angles of the eye. This is the openness of the anterior chamber. Keep looking at my right eye. I'm going to start on the temporal side there. 60 degrees. Grade 4. And for the nasal side, just look towards the dial here. That's a grade 4 angle. Temporal and nasal. That is 60. Looking towards my left ear. Excellent. And just for the nasal part. Look towards the dial here. Okay, that is a grade 4 angle, left eye also. Okay, sticking with the left, I'm just going to check the depth of the anterior chamber. Looking at the dial here, please. Looking fine. Same on the right eye. Just looking towards my right ear, or the dial here. Lovely. Okay, so we have a very good deep anterior chamber there, right and left. Just want to have a little scan of the conjunctival surface and the sclera now. Just continue looking here, please. Looking to your left, looking to the right, looking up to the ceiling, please. Okay, looking down to the floor, let's lift the upper lid. Grade 1, conjunctival redness, that's a good sign. Okay, looking at the dial here. Looking to your right. To your left. Up to the ceiling. And down to the floor, please. Okay, just relax. So, there's no hyperemia. In fact, I'm going to give it a grade 1. Right and left. No sectoral hyperemia. I need to examine the corneas of the eyes and the anterior lens surface and the anterior iris surface. I'm going to look for any signs of pigment dispersion or pseudo-exfoliation. Shouldn't take a moment. Look there for me. Cornea right, endothelial surface clear. Focus on the anterior lens. lens, looking for any deposits, and just the front surface of the iris. Clear. Looking to the left or to the dial there. And for the lens, and the iris. Lovely and clear, thank you. No signs of any deposits, right or left. That includes the endothelial corneal surface, the anterior lens surface and the anterior iris. Okay, now we're on to the examination of the fundus and the optic nerve head. I'm going to dilate your pupils with a drop of tropicamide. Allows me to see, gives you the best view at the back of the eyes. Okay, looking up to the ceiling. And for the other. Okay, sit back and relax. Okay, I'm going to ask you to have a seat in the waiting area, and I'll call you back through in about 20 minutes when we achieve maximum pupil dilation. Hello and welcome back. So the pupils have dilated nicely. Now we're going to use a special lens held just in front of the eyes, like so, to observe the optic nerve head in a little bit more detail. I'm going to be looking at the optic cup, the neural retinal rims, looking for any papillary atrophy, any hemorrhaging pallor. I'll be looking at the cup itself, looking for any lamina cribrosa, how obvious that's looking for any bowed back nature of the disc, any flyover vessels, all the things associated with glaucoma. Let's start with the right. So it's going to be fairly bright. Pop your chin on the chin rest. Keep looking towards the dial there, or if your view is ever obscured, just look in this direction here, please. There we go. So I'm just going to focus just by moving the lens. Lovely. To the optic nerve there. So we have a moderately obvious lamina cribrosa there, CD ratio 0.4. Looking at the neural retinal rims. Isn't is followed there. I don't see any hemorrhaging on the disc or surrounding the disc. No flyover vessels and an absence of PPA. Just go a little bit further in there. Thank you. Wonderful. Just going to check the height of the disc now. We have a height of 1.5 millimeters there. Super. Let's switch to the left optic nerve head assessment. And just looking in this direction now, please. Lovely. Okay, so there is an obvious difference in the CD ratio here, as the doctor pointed out during your cranial nerve examination. 0.8 cupping, possible superior rim thinning, no pallor, the possible nasal notching, another key feature there. No hemorrhages, slightly bowed back. Let's come further in, the magnification. Okay, let's just have a detailed look with the, if I can find it. Where are you? The green light, thank you. So I can actually see the nerve fibres a little bit better with the green light. Okay, so potential signs of glaucoma in this left, possibly normal tension. It's very debatable with the IRP being what it is. Okay. Alright, okay, let's just check the height of the disc with the white light. Keep looking here, please. Okay, we have a reading of 1.6 millimeters there, thank you. Okay, sit back. Okay. So the left eye is definitely showing some abnormal signs that point towards glaucoma. Now we need to check your visual fields, that's your peripheral vision,